Auditors' insights on frequently encountered 10 coding mistakes. Sequencing codes is essential for correct coding and compliance with HIPAA standards. When coding, check the code and compliance edits, as well as sequencing, before completing the account. Portocath, percutaneous versus open approach. Portocath placement should be coded as open approach, while the catheter should be percutaneous. Burr holes, percutaneous versus open approach. Burr holes should be coded as percutaneous approach instead of open approach. Specificity. When there are unspecified and specified codes in the same code family, code to the highest level of specificity supported by the medical record documentation. Joint replacements. The type of implant, as well as whether cement was used, are needed to code joint replacement procedures and fully describe the procedure performed. Spinal fusions, posterolateral and autologous. During spinal fusion, if the posterolateral portion is fused using a mixture of autologous and non-autologous tissue, that portion is coded to posterolateral fusion with autologous substitute. Sepsis as secondary diagnosis. Sepsis is typically the primary diagnosis, but if the infection is due to a device, then sepsis is the secondary diagnosis. Acute on chronic present on admission. Acute on chronic conditions present on admission, POA, require specific coding rules. Pancytopenia and neutropenic fever. Pancytopenia includes anemia, neutropenia, and thrombocytopenia, and both may be coded if the cause of neutropenic fever is different than the pancytopenia. Combined codes. Coding Guideline 1.B9 advises, multiple coding should not be used when the classification provides a combination code that clearly identifies all of the elements documented in the diagnosis. Stay updated on the latest industry news, and more by connecting with us. Feel free to reach out to us